Welcome back to Nursing with Bonomi, where we put the page into practice. This is Nurse Nay, and today we're going to talk about care plans. So this video was a request from Jane Rivera, and it's about how to write care plans in the nursing home setting. Honestly, care plans are really good for while you're in nursing school, and you don't use them too much afterwards. The way a lot of systems are set up are just check boxes. Check, 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 check. Enter. Done. However, you do need to know what is applicable, what things you should and should not check. So, what happens when you get an admission into long-term care? I'm going to specifically talk about into a rehab setting. Somebody comes in, they had a knee surgery done. So upon admission, they have to have an interim care plan initiated and reviewed with the patient within 24 hours of the admission. In that care plan, depending on how your electronic health record is set up, it might automatically pull things for you based on the diagnoses that they have. It might be separate, or it might be in line with your admission assessment that you have to document. So you're gonna have an intervention for every single diagnosis that the patient has, whatever pops up as you're doing your admission. If they're on oxygen, you want to put that you're gonna monitor their oxygen level. Things like that. That you don't want their oxygen level to be below 88 or something. So those things usually, like I said, are already pre-made, and you just click the button to add it to the care plan. Now there always is an option as well to personalize the care plan, depending on how much time you have on their initial admission. Remember, this is interim. So after you put in your initial care plan, the MDS nurses, which stands for minimum data set, they're the nurses that really review care plans and make sure they're completely accurate. They're the ones that make sure everything is ready for state when it comes to a patient's care plans. Now, care plans that you do specifically need to do are the fall care plan. You have to have an intervention put in place immediately for falls. A skin prevention plan. You need to have something in place for that, whether it's barrier cream. If the patient can walk, just encourage patient to turn and reposition every 2 hours. And then certain medications, such as Coumadin or other blood thinners, Eliquis or Xarelto, you need to make sure that you're monitoring for bruising, nosebleeds, and things like that. Like I said, don't worry too much about it. Don't stress out too much about care plans, because it's really laid out for you quite easily, and there's plenty of work for you to do. And if all else fails, MDS nurses will fix it. And if you really do want to get good at it, ask them. The MDS nurses are a great resource, and they'll really help you to get better at care planning if that's something you would like.